Hey everyone, Assalamu alaikum, and welcome to another episode of Ekram Talks, a podcast where we discuss emergency medicine core concepts and the impact of the specialty in the UAE. I'm your host Anzal Rahman, and I'm joined by my co-host Muhammad Al Koum.
Thank you, Anzal. I'm happy to be here today. For once, it's nice to be on the other side of the interview, just finishing my interview process for the match.
Yeah, just to put things into context, I was the other side of the interview for him at that point. But we're glad to have you. He's one of our new residents that have joined the program, and we're very excited to see where he goes with that. Today, we're going to be talking about emergency medicine in the UAE. And this is a topic that's understandably relatable for most of you listening to this podcast, one way or another. This is a field that has been a passion for us all, so we are reasonably biased. That's a disclaimer right there. But there are those of you who might be considering it as a specialty as well. So whether it's one of you or those in the long haul, this is by any means a dynamic and interesting specialty. But what's most interesting to me about it is the details of its inception. It's one of the only fields, if not the only field of medicine that was born out of a demand for it. Back in the day, acute and emergent critical care was handled in just an isolated area of the hospital. This is where the term emergency room comes from. And essentially just considered of an area in the hospital where a bunch of specialists, cardiologists, nephrologists, or wherever would just have rotating shifts. And this is before it became the department that it is today. All they did was handle cases urgent and critical care.
As you can imagine, they've soon found out that acute critical care is an entirely separate beast that does not translate across various specialities. Rather, has a unique aspect that altogether form a standalone division of care. Around the 70s, they eventually established one of the first training programs for the emergency medicine in the US, which makes it this an especially young specialty all over the world. Couple that with the fact that emergency medicine in the UAE, particularly when it comes to physician training, is an even newer concept, being just about a decade old. Give or take a few years and you can really appreciate a kind of exciting possibilities such an evolving specialty can bring. That being said, let's move over to our special guest for today.
Joining us today is none other than Dr. Saleh Fares. Dr. Saleh has been synonymous with emergency medicine in some way, shape, or form, and odds are if you work around emergency care within the UAE, you either know him professionally, personally, or have heard him speak at a conference or a community activity or some event or the other. His background and career has been impressive, to say the least, and I am going to try to give you guys a brief overview. Can't promise I'll cover everything because there's a lot to unpack here, but here goes nothing. Guys, hold on to your hat. Dr. Saleh completed his medical education at the Royal College of Surgeons in Ireland in 2000. He then went on to do Royal College of Emergency Medicine residency at McGill University in Canada. This made him the first Canadian and American board-certified emergency physician from the UAE. In 2008, he completed a fellowship in emergency medicine and emergency medical services, that's AMS, at the University of Toronto in Canada, followed by a disaster medicine fellowship at Harvard Medical School in Boston, as Harvard's first disaster medicine fellow and also a co-founder of the program. That was back in 2009. Moving on. 2011, he obtained a master in public health from Johns Hopkins Bloomberg School of Public Health, and he is currently pursuing a doctorate there as we speak. Currently, he works in the UAE as a consultant, the head of the emergency department, and the program director at Zayed Military Hospital. He founded the Trauma System Initiative of the Emirates of Abu Dhabi and is also the founder and president of our parent society, Emirates Society of Emergency Medicine, or ESEM, since 2012. And while I take a breath, over to you, Dr. Saleh.
Thank you so much, Anzal, for the kind words, and definitely overstated, but it's my pleasure to be here, and congratulations on such a podcast. I'm so thrilled to see the new generation taking off to the future, inshallah. I see a very bright future. Again, thank you so much for the kind introduction.
I have to say it's an absolute honor to have you with us. Though we do work together, listening to the breadth of accomplishments behind you really puts into perspective the diversity that lies ahead as we enter into the field of acute and critical care. Having just started my first year as a resident, this brings to mind the question that many of us ask ourselves, and indeed the biggest one in each of the interviews I went through during the match process, and that is why emergency medicine. Certainly we all have our reasons for getting into this field, but I wonder, with all the experience and accolades you gathered over your practice, if you ever go back to when you were in my position and wondering something similar, and if that concept still resonates today.
This is definitely a very important question, and I value the dilemma that everyone goes through. This takes me back to, I would say, what now, 25 years ago when I was medical student. like any other medical student who goes through the different rotations, surgical, medical, thinking of his future. Definitely at the time, being general practitioner wasn't enough. So you always need, and as time evolves now, you need to go into some sort of subspecialty. So in Ireland, at the time, as a resident or as a medical student, I go through the emergency department, which was called the Accident and Emergency in Ireland. You see the different critical cases, the life and death, how medicine can truly save life. And we need to act and make decisions within seconds. So this really stayed on me. And, being from the UAE here, going back during, vacations or so on, you hear stories of really truly preventable deaths, something that we can avoid by true intervention, by public health education, and so on. And that really, rang a bell at the time of, considering emergency medicine. When I finished my internship, and obviously during my internship, I really got involved more into emergency medicine and seeing more even critical care cases. So when I returned to the UAE, I met a couple, and at the time, that was 2001, I had the honor of meeting early founders of specialists of emergency medicine. They were at SKMC, Sheikh Khalifa Medical City, at Dubai, and so on. And they really, they graduated from North America, where it's officially, where the emergency medicine really was born. I saw a different angle of emergency medicine, something that puts everything together. So we do care for emergency surgical cases, medical emergency cases, pediatric, and so on. So I saw something new. In Europe, there were no established programs at the time, that will look like into a residency program in emergency medicine. And that made me explore and talk to people in North America. And that, at the time, Canada was definitely an excellent opportunity for me. I applied and had the pleasure of joining McGill University, which is called the Canadian Harvard program. I'm definitely honored to be part of it. It's the first Canadian emergency medicine program. And I had the pleasure of working with leaders of emergency medicine, saw a completely different angle. How you as a physician can definitely intervene in the initial minutes, really take important decisions of saving lives. And you're not just looking into a surgical aspect of things. You're not looking at medical aspects of things. You're actually the person who puts everything together. And I think I found myself into that career, and I honestly did not, and I will not regret a minute of choosing this specialty.
I could not agree more. I think one of the things that resonates with me specifically or personally, having been in the residency program for a while now, I'm just on the cusp of having finished it now, actually. Well, fingers crossed. Is that saving lives aspect is more evident in emergency and critical care than in any other specialty so far. I mean, we all, work on, I sort of give an analogy of working on a car. Everyone sort of fine tunes the car. We're the ones that are there when something bad happens. And essentially we have the honor and privilege of having felt that in many of our patients, especially, Alkum, you're going to have this over time, feeling that you've done something to avert disaster. So you are basically staring death in the face and, bringing those patients back. And that, I think, is one of the things that when we all go into medicine with that noble intent of saving lives, you actually do feel in the specialty. So I think that resonates a little bit with me, though, of course, I still have a lot to learn. Having said that, this also brings into that point where emergency medicine is the best 15 minutes of every specialty. It also becomes a very interesting dynamic that we follow when we're working in this field. However, you mentioned this huge breadth of accomplishments and so many things that you've seen change. And certainly, you've brought in that concept translation from North America into the UAE, but it's still relatively a new field. What do you feel back then and versus now with all the changes that have happened in this field? What have you seen, or what has been the outline of the changes in the field or the specialty as a whole that perhaps you would, you'd feel more of an outline than anything else?
I think Anzal, thanks for making me sound old, but I think
that was not my intention.
Yes, but I think I'm not the expert in emergency medicine, but I think what I'm proud of that I managed to get a good team together, being able to work together, and to I was fortunate to have the right people around me. But looking back, it's definitely, I agree with you that definitely, like any other specialty, emergency medicine evolved, with around 20 years of experience or so. The most important aspect of emergency medicine that I've noticed is recognition. Going back, I'm not talking about North America, they took their own steps too. But in the region here, especially in the UAE, coming back, introducing myself as an emergency physician, that wasn't very clear specialty. I have to explain myself. I have to, explain that it's more than just general medicine. In the past, with all respect to our colleagues who really did amazing job at their time on emergency departments or accident and emergencies, as they used to call them, they did their part with their own knowledge. But when you come up with a different approach that, I don't need to call a consultant for everything. I don't need to, I can make decisions my own. I can resuscitate those patients and then call the specialist. That makes a different angle into it. So I think over the years, alhamdulillah, we managed as a specialist, not myself only, but I think everyone in the UAE and in the region to really be able to draw an important attention. If you go 20 years ago and now, I think a lot of people now would like from, officials, different policymakers and so on, they would like to have an emergency physician involved in the decision making. Why? Because they know different angles that many other specialists may not capture, given their own specialty. Also, over the years, I think we managed to, to see more subspecialties. At the beginning, yes, we saw just emergency medicine. Now we see ultrasound, we see trauma specialists, we see emergency medicine educators, we see pre-hospital care, and so on. So I think all of this is giving a fresh breath, evolving, breath to the specialty, where we can definitely evolve. I have a background of public health, as you mentioned, and to be honest, that really gave me a different angle myself. Rather than seeing, trauma cases in the emergency or cardiac arrest and so on, the public health lens, I would say, or eye, gave me a look into, why should we go into prevention? Why don't we do something about all of those cases that keeps coming, pediatric injury and so on? And that gives you a motivation to go into a system level and be able to or contribute into your community. How can I really prevent those cases? How can I boost, the emergency medicine specialty? Why not the emergency departments have emergency specialists rather than general practitioners? Why? Because the emergency specialist will be able to do more and contribute more in the very crucial minutes of patients' sickness. So all of this really, I think, evolved over the years. And then, I think technology, having, very easy access to knowledge now, rather than, running around with a book. Telemedicine is important. Now we are in tertiary hospital, be able to, supervise, communicate with our colleagues in rural areas, and contribute to a better patient care. So I think many, evolution of emergency medicine happened in the UAE and in the region, but this is just to mention a few.
With so much going on, and there's a long and exciting road ahead, like what advice do you have for us younger generation, younger physicians looking up to you? Like, what are the unique lows and highs of emergency medicine?
I think emergency medicine definitely, it depends how you want to look at it. One, if you are really convinced, like any other specialties, it has the ups and downs. The ups, I think, I always say that we are definitely the main gate of of the hospital. We see it depends how much you want to position yourself. You can definitely see many cases. You can manage them as well as you want, and that you will definitely gain respect within your own institution. If you want to go up to the community or go out to the community, being an educator, being a public health advocate, all of this will definitely position you as the right person, because the community in general do care a lot about emergencies. So you being and talking about experience definitely give you credibility. I always make fun of it. I think we're the most interesting people to listen to on like dinner tables. We have so many stories. I always say that we never had two shifts alike. Different stories, different, funny and sad stories.
Some of them not appropriate for dinner tables.
Absolutely, yeah. That's definitely the case. So the ups of it is definitely the value and the depth of the specialty, the ability to communicate, to contribute to the community. So it's really more than just the shift, more than just an emergency department, is more and goes beyond to the community and so on. Alhamdulillah, through the years, as I mentioned, with the right team, we managed to work on establishing a society, the Emergency Society of Emergency Medicine in the UAE here, which for those who don't know it, it's like any other professional society who puts the specialists together. Now I can pick up the phone and call any of my colleagues under ESIM umbrella. Before, we're in different facilities. We don't belong legally to each other. So that created a sense of community within the UAE. This, alhamdulillah, expanded, and ESIM contributed in introducing the idea of having a Gulf Federation of Emergency Medicine back in 2014, which was announced officially in 2017. This by itself now bringing the Gulf states together. So, and slowly, if you notice that we're expanding in terms of emergency medicine recognition as a community. Alhamdulillah, the society contributed, for example, in introducing the recent Good Samaritan law. As the first Arab country to have such a law, I always been getting phone calls. Why don't we, contribute to saving lives, being protected as bystanders to really resuscitate out in the community? Alhamdulillah, with this law, I'm very happy and very proud of being part of ASIM, who contributed to such law. So there are so many ups. Downs, I really don't look at them as much, like any other specialties. Exhausting shifts sometime. But again, if you love the specialty, you love it. There are so many long, if you look, for example, neurosurgeons, my cousin is a neurosurgeon, and other people, they stay in the OR for like hours and hours standing. If you want to think about different specialties, they also have their downs. But in emergency medicine, we have, different shifts, antisocial hours. You're unable to attend a dinner party or like a wedding or something because you do have a shift. But you know what? Shift life is a good thing for many other people. So I think maybe the down is sometime in certain, especially in the region here, that we're trying to advocate the ownership of the specialty. Emergency medicine as a specialty now, apart from the academic residency programs, we want to put it together. There should be an overall umbrella where the government able to legislate, regulate emergency care from a system level. Mm-hmm. This is something we're working on. I think billing is important here. A lot of our colleagues work hard in shifts. We want to compensate or help, have a better payments. I think very frustrating side of emergency medicine working in the region is the misuse of emergency departments. A lot of non-emergency cases come to the emergency. So this is something hopefully you guys can work on in the future, try to educate the community and being able to use adequate clinics, and so on. Most importantly, I think we need also to educate and uplift the role of prevention of emergencies and try to contribute on a bigger angle.
I agree completely. I think something what you said is something that I had not really anticipated when I first started working in emergency medicine. I had thought of it as a pure clinical focused, dynamic environment where I'm doing my thing and it's pathophysiology. That's the way we learn, when we're in med school, and sort of disease management, disease treatment. But what I did learn over the past couple of years is what you mentioned about community, is how strong of a role I did not expect we'd play in counseling and worrying about how public safety impacts the people around us. It's not just patients that we're seeing. We're sending these people back into society. And oftentimes when they come into the emergency department, this is a huge point in their life. It's a milestone in their life where for some people, it's a wake-up call. Where it's the best time that you can sort of send them away and say, look, you need to make a change in your life. Otherwise, this can happen again. Whatever you came back from was due to certain risk factors or things. And of course, cardiac illness and accidents and all these kind of measures, they sort of all come into play. It's a whole network of things that comes together. And so education and counseling for me was something that I had not anticipated. I mean, we always learn about it, but we did not think about it when we first go into the clinical shift. That being said, with such a broad spectrum of things being a part of emergency medicine, especially under the umbrella that's growing every day, what do you see as the future of this specialty as it continues to grow with all these diversifications that exist within it? And specifically in the UAE, how do you see the future of emergency medicine propagating with its impact around the world, here locally and internationally, as we have seen with your societies?
I think I want to clarify one point, because that's sometimes, if we take it the wrong angle, it turns off people. Which is, as an emergency physician, you don't have to go out to the community. It's an option. Mm-hmm. I'm biased. I did public health. It gave me a different angle. But I have amazing colleagues who are excellent in, ultrasound, for example. So that's uplifting. You're contributing to the community by educating your colleagues into the best use of ultrasound. You have trauma specialists, so introducing better trauma care and so on. So you don't have to just do public health. Maybe I was, as I mentioned, biased to this. But at the same time, regardless of what subspecialty, the amazing part of emergency medicine that it has, a huge, subspecialties too, from toxicology, from trauma, as I mentioned, pre-hospital pediatrics, emergency medicine, and so on. So that by itself, it gives you a very rich specialty to go into, and you have 4 or 5 years, it depends which program you do, to think about another subspecialty where you go into a fellowship and really pursue. So it's a very exciting subspecialty. I love doing what I'm doing now. I did EMS, for example, as a first fellowship, and disaster medicine, blending both together with a public health really gave me a new perspective into let's say a system level involvement. And I'm writing a paper on this I called it the Emirates framework. I hope it will be published soon, and please feel free to read it. It will give you a different angle of how do you look at the emergency system in a healthcare. How do you prepare it? How do you really work on it and try to put all the pieces of the puzzle together? What is the future? I'm not a magician, but thinking forward, I think seeing the past 20 years, looking forward, I think I really put a lot of money on residency programs. I think you guys are the future. The stronger residency programs we make here, the stronger the residents, stronger future specialists who will be staying and contributing to the community, similar to my generation. Another thing I think we need to look into making emergency departments in the country and the region emergency specialist based. Knowing emergency medicine now, there's no time to guess how you treat the patient. You need to know what you're doing. So we do need definitely emergency specialists. This takes time, but I don't see it as general practice based departments anymore. So inshallah, this is something I'm sure with the increased number of residents and specialists, this is inshallah coming in the future. With the knowledge of research, I think it's very important also. Research, if you look at it, it's not an academic activity. It's actually a quality assurance. You look into your practices, open new windows for projects and so on. So, and I'm very thrilled actually by the amount of research interest I see around me with the residents. So this will definitely progress, and I do see a culture growing. And we as ESIM also trying to conduct different research workshops. We're really pushing it. And inshallah, this will definitely evolve over the future. In terms of fellowships, I think that's also very important. This is a natural growth. As you see emergency medicine residency program grow, automatically you're going to see fellowships coming out of this. So I do see a couple of fellowships coming, inshallah. I don't want to mention any specific ones, but inshallah, it's with the motivation. We will see a couple, inshallah, evolving in the next couple of years. And finally, I think thinking of the UAE as a hub for education, I think ESIM positions itself as one of the most important emergency medicine societies in the region. We're proud to say that our conference, the annual conference, is the largest in the Middle East. Alhamdulillah, had a very good and still has a very good reputation. So we look into you guys helping of establishing a very strong educational activities, not just depend on conferences, rather smaller courses, virtual projects, and so on. So be the hub of education, emergency medicine education in the region. And this, inshallah, I think we have the right talent, we have the right group and team to do it.
Thank you very much for those kind words. Honestly speaking, we're very much looking forward to reading the paper that you were talking about. And I think bringing things together, having emergency be an amalgamation of different things, it does sort of ring true, especially when you consider the numerous amount of specialties and fellowships and the other ones that you mentioned. So hopefully these niche areas, they're all combined to make a whole, and we're very excited to sort of delve into those topics. The research part, I couldn't agree with you more. Again, going back into a little bit of my bias about emergency medicine is that we have to use these clinical decision scores, because we depend more on research, because we have to base our decision making on probabilities that are the highest probability of good outcomes. So I think with ESIM's initiatives on research and education, we have been able to formulate some local scores and researches and educational activities, and this is probably one of the biggest ways that we're going to be impacting our decision-making process in the future. We're definitely looking forward. I'm basically again at the cusp of finishing my residency, but there's a long road ahead. Alkum, I'm sure you're excited as well. You have a couple of years in our program, so
yeah, hopefully I make the most out of this few years and look up to you guys and make the best of it.
Dr. Saleh, I think this is it's been a pleasure of ours to have you on board, for taking the time to speak to us, and hopefully to the listeners as well. You've been one of the most approachable people that I've ever met, despite all of the accomplishments you've had. You've been one of the most humble mentors that I've encountered. So it's been a pleasure. I'll be seeing you around definitely, but thank you very much for being a part of Ekram Talks, one of our first episodes.
And yeah,
I hope you enjoyed yourself. And it's been a pleasure. Thank you.
Thank you, Anzal. Thank you, Alkom. It's been really a great pleasure. And I again thank Ekram for this initiative. It's my honor to be one of the early and first couple of speakers. But inshallah, look forward to having you and welcoming you again, and more contribution to ESIM. And I'll pass the hat to you guys, ESIM hat. And I'm definitely very comfortable of and very confident that the future of ESIM, inshallah, will be very bright with such talent.
Inshallah.
Thank you.
Thank you.
Thank you.
That wraps up our session for today. Thank you all for tuning in.
I'd like to give a special shout out to Dr. Basil Derbel, who is responsible for all the fancy music in the background. And with that being said, thank you very much for listening. See you next time on ECRIM Talks.